Good afternoon, everyone. I'm Becky Wittes, Chairman of the Niagara County Legislature. Thank you for joining us live on LCTV for our daily Niagara County COVID-19 update. We are also currently streaming live on lctv.net, the Niagara County Facebook page, and we're on 90.9 FM on your radio. Let's start right off with our Niagara County updates for today, which we received from the Niagara County Health Department. Today, they are reporting 12 new positive cases of COVID-19 in Niagara County, which brings our total to 155 to date. We have 103 positive individuals in isolation. 86 of those are isolating at home, and another 17 are in hospital isolation. The good news is 51 people have recovered, and unfortunately, we had the one COVID-19 related death, which we announced yesterday. Our Niagara County heat map is now updated again. That breaks down the positive cases of COVID-19 in Niagara County by municipality. And that link can be found on niagaracounty.com. At the top of the page, under the COVID-19 banner, there's a link. And you can take a look at that map. It shows by city, town, and village how many cases have come back positive. That information comes in from the New York State Department of Health each day, so we try to get that map updated before noon as soon as we've received that information from the state. We do that every weekday. I also want to bring your attention to a new map that's been put up by New York State, which shows all of the information across the state broken down by county. You can find that map at covid19tracker.health.ny.gov. They update the data regularly, and it might answer a lot of questions that you have on additional information that we don't give out daily. For one example, it shows the number of people who are tested by county. According to the numbers on that state map, Niagara County has tested 616 people. About 20% of those tests come back with positive results. Remember, we're a county of about 216,000 in our population. So looking at those numbers, we talk about the lack of testing. Those numbers really bring our point home as to how few individuals are being tested here in Niagara County and how frustrating that can be for us. But if you look at those numbers across the state, again, broken down by county, you will see that that is a problem statewide and not something that's different here in Niagara. There are many counties in that situation. Our governor told us today that we had an additional 779 deaths statewide to COVID-19, and that is the highest single day to date. But he also expressed some optimism. We're seeing that the new hospitalization rates across the state have gone down. Those continue to drop, and we're seeing a flattening of that curve that they talk about. Deaths increase. That's to be expected. We see that the individuals who are on the ventilators for an extended period, the longer they're on, the less likely it is that they will come off. So those higher death rates that you're seeing now are explained by the fact that those were individuals who were hospitalized in the earlier stages, have been on ventilators probably longer term, and those rates are now catching up. That death rate lags behind hospitalizations for obvious reasons. With some signs beginning to create optimism, however, we have to remember that we don't want to create another spike in that curve. For starters, we feel that Niagara County is probably slightly behind the time frame from what they're seeing downstate, that we haven't reached our peak yet of that curve, if you will. New York State pause is still in effect, and we need to remember it's very important that what we're seeing is that effort is helping. The fact that everyone's staying home, staying distanced from each other, the governor truly believes that those efforts are helping the situation, and that's why we're starting to see that flattening of the curve. So I remind you again, please, it's very important that we continue to follow these rules. That optimism, the fact that we're seeing, these better numbers for hospitalizations does not mean that you should stop what you are doing. New York pause is very much in effect. We need to keep those efforts in place and continue to work on what we're doing here locally. The governor did increase the maximum fine from $500 to $1,000 for violations of the state's social distancing protocol. And you should know that if you have a concern, we've heard this multiple times from people in the area who think maybe a business is open that shouldn't be, or they're seeing social gatherings happening out and about that they don't feel are appropriate. There is a state complaint line for those situations. You can call 1-833-789-0470. There's also an online complaint form that you can fill out if you prefer. Of course, we've had both District Attorney Caroline Wojtasek and Acting Sheriff for Niagara County, Michael Filicetti, on with us to talk about these situations, and they are handling those complaints locally as well. So you can continue to reach out to them as you need, and they will look into those situations and see if they need to enforce those rules. But really, legal measures are not the answer here, folks. We know that the answer is to stay home and do the right thing. New York State announced today they're starting a social media campaign about who you are staying home for. We've talked again and again about, the younger crowd maybe thinking that they aren't susceptible to this, that they're healthy, that they're not going to be affected. But we do know that if you bring this virus home to others, to the more vulnerable community, that's where we really see the social contact spread. So we need to remind everyone, find your reason to stay home. It's not just about you, it's about all of those people that you care for in your life. It's about protecting the health of others, plain and simple. Maybe that's a grandparent, a neighbor, or the healthcare workers who are out treating even more people because you went out and helped that spread to occur. I'm staying home for my family, and also for the Niagara County first responders who have to be out each and every day to show up and do their job, knowing there's an increased risk right now. Please think about who you're staying home for and continue to do that. Shifting to county services, most of the inquiries we get are about DMV. Certainly we know that things like driver's licenses, inspections, registrations, all of those things that would have expired during this crisis time period have been extended by the state until further notice. However, there are many people who need to register newly purchased vehicles and get plates for those to be able to get them on the street legally, and they haven't been able to do that up until now. Niagara County Clerk Joe Jastrzemski announced today that he does have a new process in place for individuals to register their vehicles, get license plates or transfer plates between vehicles by mail. This is a limited service that is going to be available to Niagara County residents only at this time. And you can go on to niagaracounty.com, click on the Department of Motor Vehicles drop-down to go to their website for very specific instructions about how to utilize this process. And we know, again and again, we hear stories about individuals who are struggling right now. Again, a time of uncertainty and stress and anxiety for everyone, whether you're out on the front lines or if you're just concerned about your own health, your family's health. We want to remind you again that crisis services at the mental health department is available for you 24/7. That's free and confidential information that you can contact them at any time. We also know that this can be a difficult time for those who struggle with substance abuse disorder, issues with drinking or drugs or any of those things that people struggle with on a normal basis can be much more difficult at this time, again, with the added stressors and being home and not being able to go to those support groups and things that you would normally utilize for help. Please, again, if you are having those concerns, reach out to the Niagara County Crisis Services line and they can help direct you to the support that you need. Again, that number is 285-3515. If you joined us late today, no worries. You can catch us later on demand on lctv.net. If you go to the Niagara County Legislature page, they will have a link that you can rewatch this broadcast. We've also reached out to our local media stations, TV stations, newspapers, and asked them all to please utilize this broadcast to get information out to you in their daily reports as well. So we thank you for helping us. All of those other stations that are picking us up, we appreciate it. And of course to LCTV for their partnership and helping us reach the residents. You can also go to the Niagara County Facebook page. We will have the link as well on there so that you can rewatch as you have time. Most importantly, folks, again, we hear these numbers, you know, the hospitalization rates across the state, again, starting to flatten out and look like the staying at home, the physical distancing is starting to work, but take that optimism with caution. Again, we feel we're slightly behind that time frame in Niagara County, and to see this continue to work, we have to continue to keep those practices in place. So I ask you again, for your health and safety, for those that you love, stay home, stay safe, and stay healthy. Thank you.